My name is Dr. Hovis. I am faculty at MCW, and I've been here for about 5 years now. And I specialize in what's called ambulatory care pharmacy, which is really, if you think about it, like ambulatory is not an ambulance where we're like in a hospital or driving around with an ambulance. It just means to walk like in a walking clinic. So I'm assuming at some point you have or have had a primary care physician. So an ambulatory care pharmacist generally is embedded in an outpatient clinic where you might see your primary care physician, and we help to support the duties of physicians, nurses, PAs, NPs that work to care for patients over the long term, usually helping in chronic disease management. So things like hypertension, diabetes, hyperlipidemia, heart failure, different conditions that people have for long periods of time that we do our best to work together with our colleagues to make sure that we're doing a good job at taking care of your chronic disease. In the state of Wisconsin, we have really flexible laws that enable us or allow us to prescribe medications that, as long as we're delegated to do so by a physician colleague who we're working with. So I will get into the example that I'm going to talk about is really my clinic where I help manage people's hypertension. So I'll give you a concrete way to think about that as we go through the presentation. And one thing I think I want you to think about is this is just one application of the PharmD degree. I think this is something that I make sure any student who's thinking about becoming a pharmacist is aware of, right? Most people think of pharmacists in a retail setting, like a Walgreens or a CVS, and you're behind the counter and you're dispensing medication, which is a very important role for pharmacists to play, but there's a lot of other roles that pharmacists play within our healthcare system. So I hope by giving you this one example, you can appreciate that a little bit. But like I mentioned, there's lots of different examples of pharmacists doing work that's similar to this in different disease states. So one thing I want to mention, and this is related to what I was just talking about, is that the role of the pharmacist is really evolving. Historically, pharmacists have really been tied to the dispensing of medications, right? We're in the brick and mortar pharmacy store, we're dispensing medications, and our salary is really paid for by purchasing these medications and selling them with a little bit of an upcharge, including a professional fee for the service that we're providing, which is receiving the prescription from the physician, making sure that it's safe, it's at an effective dose, and then dispensing it to our patients and giving them counseling points, right? So that's sort of the old model of pharmacy practice. It still exists. We still have many pharmacists across the country that do this. But really in the last 20 years or so, we've had this shift that's occurring where we're working more toward this idea of providing value to patients in the healthcare setting and trying to work toward improving the care that we're delivering as healthcare organizations. So you think of, I'm not sure where you're from or what city you're dwelling in, but I'm assuming there's a health system that has maybe it's a well-known health system. In Milwaukee, we have Freighted and MCW is the health system that I work at, that our medical college or our pharmacy school and medical college are affiliated with. And that's where a lot of our faculty practice. But we work with our colleagues really to try to better meet the needs of patients in these settings. And in this bottom left-hand corner, there's this thing called the triple aim that is really a guiding light for any healthcare organization in the United States at this point. And what we're working toward is trying to improve the health of our patients, do this for a lower cost, and provide better quality care. So there are things called quality measures that we can use as a marker to show that we're doing a good job of taking care of people and making sure that patients are satisfied with the care that they're receiving. So it's more of this service-based role as opposed to being tied to the medication product. This is an industry forecast from a major consulting firm, Deloitte, that talks about really the future of pharmacy practice. And they identify 4 areas of growth in the industry. So by the time, if you're applying for this next year, then you'd anticipate from our school, you would graduate 3 years later. So if you're entering pharmacy practice in, 4 or 5 years, what might you anticipate the profession would look like? And this consulting agency predicts that you'll see growth in primary care, so helping to care for individuals with chronic disease states and making sure we're getting them in to see appropriate specialists and doing a good job at taking care of what conditions they have and optimizing the medications they're on. Specialty care, so working with some of our specialist colleagues to be subspecialized pharmacists, so we can specialize in things like oncology or cancer care, cardiology, respiratory conditions. So you can subspecialize in really any disease state, any medical specialty that there is. There's a place for pharmacists to augment what those physicians are doing to help take care of patients. So that area will grow as we have more advanced and complicated therapies to help treat different conditions. Digital health will grow, and this is something that my work overlaps with. So using new technologies to advance the care of chronic diseases. So things like wearables, think about like your Apple Watch, or different monitoring technologies like continuous glucose monitors are new technologies that allow us to see what people's blood sugars are at any moment in time. And then population health analytics. So using big pieces of data to help identify care gaps and needs for patients and using that to drive some increased value in care. So now I'll focus on talking to you about the specific application or example of pharmacy practice. And this is my practice site. So just to kind of explain a little bit more about my role, 3 days a week, I am at the school, at the School of Pharmacy at MCW, lecturing to students, working in patient care lab, meeting with students, course directing on some of our courses like population health and advanced cardiovascular disease. And then 2 days a week are my clinical days. So that's when I'm at this practice site. And I'll talk to you about what specifically we're doing in this practice site. We call it the Digital Care Monitoring Program. So digital care monitoring program, we used text messages to facilitate communication of home blood pressure results. So patients who enroll in this program, it's a voluntary enrollment. We identify patients who have uncontrolled hypertension, and we send them a message and say, hey, would you like to participate or join in this program? If they consent to that and say yes, then we send them twice weekly text messages with a prompt to have them send a blood pressure reading. So ECOW, let's say you sign up for it, we'd send you a text twice a week and say, ECOW, what does your blood pressure look like today? And we set patients up with home blood pressure monitors. So we'll actually physically in the mail send them an automatic home blood pressure monitor. And we talk them through how to use this monitor. And then in theory, once we send that text message, you use the monitor to get a blood pressure reading and you text back and say, today my blood pressure is 140/90. Then we collect that data, and on the back end, we will stratify patients in terms of risk categories. So how well controlled is their blood pressure? So this is a good visual representation of this. We get this list of patients who are eligible. We work with a vendor to call patients and see if they want to participate. Patients say, yeah, I want to participate. They get this twice weekly text message. They send us their readings, and then we categorize them in red, yellow, or green risk, depending on the average, a rolling average of what their home blood pressure readings are. And then we work with an interprofessional team. So it's myself and a medical assistant that work together to determine the next most appropriate step for these patients. We're working specifically with red risk patients in our clinic days, but we have certain interventions for our yellow risk patients and green risk patients as well. And then we communicate and escalate this to their PCP as needed. This gives you just a little snapshot of what the risk categories are designated as. So again, it's a rolling average of what their blood pressure readings that they've reported back to us are. And then if they're red risk, they get a certain set of interventions. If they're yellow risk, they get a certain set of interventions. And if they're green, we really just send them a congratulations message. So the red risk patients, I will generally reach out to these patients and see what medications they're taking, how they've been managing their blood pressure, and what direction we might choose to go there. And I mentioned the state of Wisconsin has really I would say, like generous laws with respect to what it enables a pharmacist to do. So through working with my physician colleagues, they delegate prescriptive authority to me, and I'm actually able to start new medications, increase the doses of medications, order specific lab tests, and talk about and even prescribe different adherence interventions and lifestyle interventions like improving diet through the DASH diet and optimizing their exercise or physical activity. For our yellow risk patients, we send them a quarterly My Chart message. That's what MCM is. So it's basically just a secure message over our electronic medical record that says, these are some things that you can do to improve your blood pressure. Do any of these speak to you, or do you think you could work on improving any of these? And then the green risk patients I mentioned, we just send like a quarterly message saying, great job, congratulations, keep it up. So I mentioned we work with a medical assistant who really is our front line of defense. She answers phones as patients call in. She'll onboard newly enrolled patients. She'll send referrals for physicians to co-sign to enable that prescriptive authority for me. So she'll schedule patient appointments for me to talk with these people to help improve their blood pressure. She manages incoming alerts. So if somebody sends a really high blood pressure, like 220 over 100, which might put somebody at a severe risk of having a stroke or a heart attack in the short term, she'll help to escalate that to the triage nurses who can decide whether a patient needs to go to the emergency department or not. And then she sends out these My Chart messages to help patients determine if there's any of these lifestyle adjustments that might work well for them. Me as the pharmacist, I directly outreach to these red risk patients. I coordinate their treatment plans with their primary care physician. I work directly with our MA all the time. We are sending messages back and forth throughout the week, but especially during clinic days. I will respond to patients via My Chart so we can have the secure communication. And then I also manage the program. So I create and update different educational materials around this program. And then ECAT, just to share with you, this is some data that we've been collecting about the effectiveness of the intervention. And what we see is that before individuals sign up for this program, their blood pressure on average is about 157 over 98 millimeters of mercury, which is pretty elevated. If you have no prior knowledge of hypertension, which we wouldn't expect you to have per se, this is a pretty elevated blood pressure, puts people at higher risk for having a stroke or a heart attack. Post-intervention, so after we enroll them in the program for at least 1 year, we see a drop of about 20 millimeters of mercury as systolic and 14 millimeters of mercury diastolic. So there's a pretty significant decrease, which will reduce their risk of having a stroke or a heart attack. So we're pretty pleased with the results we're seeing, and the health system is pleased with it. So we're going to continue going on with this, and we're actually in the process of writing a bigger grant to expand this to other health systems to really make this the standard of care in the greater Milwaukee area. So more to come on this, but we've seen some really promising results here with this particular program. So that's it for what I have formally about this specific program, but do want to reiterate, this is just a slice of what pharmacists do, right? These types of interventions exist for every single disease state. And I think it's a really exciting time to be a pharmacist because you've got a lot of different interventions you can creatively think about and trial and see if they work to try to improve the care of patients and this idea of adding value to the health system. I think we have a lot of flexibility and autonomy to try different things at this phase of where we are in providing care in history.